When I'm on stage, I feel such a rush of joy and excitement and all of these different feelings bottled up into one person. My name is Analise Scarpaci. I'm 18 years old, and I am an actress, singer, and dancer living with Crohn's disease. If you thought it in your head, guess I was wrong. My first big audition was for Billy Elliot on Broadway. I was 10 years old. After the audition, I felt very weak. I had been to the bathroom a lot, and I started bleeding the day after my audition or a couple days after. My dad said, no, this is not right. You have to go to the doctor.
When Analise first came to New York-Presbyterian Weill Cornell medicine, she had had blood in her stool for over a year. We had performed an upper and lower endoscopy, and we realized that she had Crohn's disease. Crohn's disease is one of the inflammatory bowel diseases. You can have belly aches, fevers, you can have blood in your stool. Because it affects the upper GI tract, you can actually have poor growth, and that's something that Analise showed. Over the past 10 years, the landscape of treatments has changed dramatically. Today, we're actually able to pick out precisely what medicine would be best for a particular individual. And so after a very thoughtful discussion with her parents, we decided on using a biologic called infliximab.
Every 7 weeks at my infusions, I meet with my nurse. After I'm finished with getting my vital signs taken, I go to my chair and I wait for my medicine. I created this relationship with all of my nurses and my doctors. They are the most amazing people.
When Analise first came to our center, she and her parents understood that we had a number of research studies that we were doing. One of the research studies that she has been involved in is the live IBD cell bank. Working with Dr. David Artis and the other investigators in the lab has allowed us to look at patients' genetics, their intestinal microbiome, and their tissue in order to understand what is going on within their immune cells.
The quantum leap that the pediatric IBD live cell bank has enabled us to undertake is that working with live cells isolated from patients is allowing us fundamental new insights into how the immune system is changing in the context of pediatric IBD. Once diagnosed with inflammatory bowel disease, this is a lifelong condition. So there is an urgent need for us to understand how this disease develops and how we can intervene therapeutically to make sure that we improve the lives of patients. Were it not for the partnership between Weill Cornell Medicine and York-Presbyterian, plus the patients like Analise and her family, we would simply not be able to make the scientific advances that we are making right now to understand this complicated group of diseases.
When I was 13, I was extremely fortunate to have gotten a role in A Christmas Story, the musical on Broadway. It was just an unforgettable feeling. I couldn't get the smile off my face. My mom was screaming, my dad was screaming. I called my grandparents, it was just a lot of screaming. I went for treatments every 7 weeks. I never missed a performance. 6 months later, I booked Matilda on Broadway. I went for my treatments, went to school full-time, and I still performed.
One of the things that I think is so important when someone is diagnosed with a chronic illness, and especially children, is to never take away their hopes or their dreams. And so early on when she came to me and she said that she wanted to be an actress, I was going to do everything in my power to make sure that she got to that point.
If I could say anything to my team, is a huge thank you for everything. I mean, they have watched me grow up, and they're a part of who I am today.